Hello, friends. Welcome. I am Ananda Rose, and today I have Lynn Drewett with me, and we are doing Vite Bites, our fourth edition, I think. How are you, Lynn?
Mhm. I'm great. Thank you, Rose. Thank you for inviting me to do our next segment. I'm very excited to be here.
This is good. I like that we're doing this. I've been getting so many insights about Vite Bites and where we take it to because I believe, yeah, it's quite unique what you do, and we should not lose the uniqueness. We need to make sure that we embrace it, right? Okay, friends, if you've watched us before, you know we're talking about vitamins. And Lynn gives us some vitamins or a vitamin she's talking about on the day and tells us why it's good for us, how we can use it in conjunction with others, what it does, how it supports it, and how we progress with that, why it's good for us. Now, today, before we carry on, I'm going to make the disclaimer. All right. I think we'll start off with making the disclaimer. So our disclaimer is that Lynn Drewett provides guidance on vitamin intake. However, she emphasizes that she's not a medical doctor. The information shared in this session is intended solely for informational purposes to encourage thoughtful consideration of options for supporting personal well-being. This discussion does not replace professional medical or wellness advice. We strongly encourage you to consult with qualified healthcare professionals before making any changes to your health regime and always consider past, present, and future medical guidance from licensed professionals. That is our disclaimer. Okay, Lynn, what are we talking about today?
Okay, today's a little bit off the beaten track,
Okay.
as we say in Australia. And we're talking about alpha lipoic acid, not your normal mainstream vitamin, but it has a very, very important role in the body.
Okay. I'm just putting it up on the screen. You've got a slide that you've done.
Yes.
Okay. Tell me when you can see it.
Okay, I can see it. Thank you.
Here we go. All right, let's talk about it. What is this alpha lipoic acid? I have not heard of it.
Okay, so alpha lipoic acid came into my awareness a couple of years ago. I'll give a little bit of a backstory first.
Okay.
And I always knew in the pharmacy that alpha, we'll call it ALA or lipoic acid for short. I always knew that lipoic acid would help with neuropathy. So anyone who has diabetic issues, insulin resistance, neuropathy in their fingers and toes and in the peripheral parts of their body, where there's tingling, numbness, pain, that kind of thing. I
Okay.
always knew that lipoic acid does a good job with that. And for me, my personal experience was when I hurt my back over a year ago in my facet joint, I thought I would try lipoic acid because it is nerve pain, and that's what lipoic acid works best on is nerves.
Mm.
So much to my surprise, after using it for about a month, the ingredient in the lipoic acid actually rebuilds the myelin sheath around the nerve. So, and that's what happens with neuropathy. You lose that myelin sheath around the nerve, and that gives you the pain because your nerve is exposed. So, I was so surprised that because the nerve was exposed in my facet joint, because my bone had degenerated and had left my nerve exposed, how well the lipoic acid worked in my body. So in my pharmacy now, that's my story. When people come in with back pain and they have nerve pain and they have facet joint pain, and then they can see that I've had such great success. And even though I do sell it for neuropathy and diabetes and that type of thing as well, So that's my personal story with it, and I wanted to share that before we go into the other benefits of it.
Mm.
Yeah, so it's mainly diabetes, insulin resistance, nerve pain, neuropathy. That's what it, most people, if they know about lipoic acid, that's what they normally know of it, about it like that. Yeah,
Okay, okay. So I see something on here to protect eyes from oxidative stress.
correct.
What's that mean?
So the lipoic acid is a antioxidant in itself.
Right.
So with any antioxidant type product, no matter whether it comes from food sources or a little help from chemical labs in this way, the oxidative stress, which is obviously inflammation again,
Mm.
it helps with that controlling of that. So eyes get inflammation in them too, in the retina
Yep.
and in the macular. So, yeah, so it's important for that protection.
Okay, okay. And I see polycystic ovary syndrome is what you,
Yes,
yeah. So that would be again inflammation, right?
correct.
Mm.
Yes.
Okay.
So, lipoic acid is a water soluble and a fat soluble vitamin. So, there's not too many vitamins that have both sides of the fence. So, it has the ability to transfer through water in the body and fat in the body.
Okay.
That's why it does so well.
Right.
Mm.
Yeah. And now that you explained that better, I was going to ask you to explain that better.
Yeah,
Then, further than what you've got on the slide. And now that you say that, that's really good. That makes a lot of sense.
it does.
Why
Yes.
it's something, well, why it's something good. Um, what kind of foods give us this? Can we get it out of our food?
There are some foods like meat products, beef, but it's not in the amount, of course, that the body needs. The body actually does produce a little bit of lipoic acid if you give it the right food. Um, but obviously, when people have diabetes who normally take this product, their insulin resistance, their sugar levels are so high, everything is out of whack. So the body is not absorbing anything very well, even their
Okay.
medication. Yeah.
Yeah, I get that. So, Lynn, anything, look, you've explained it. Um, what else can I ask? So, who'll take this? I always like to ask, so is there a specific
Mm.
age group? Is it specific? I hear diabetes, I hear inflammation, and anybody can have inflammation. And in this day and age, anyone can have diabetes. You don't have to be old to have
No,
diabetes. You don't have to be overweight to have diabetes. In fact, people who are
no,
to be
that's
underweight
correct.
and still have diabetes, or a normal weight and have diabetes. So I'm hearing that. But is there anything else, like anyone else that any age group, any specific type of uh, that you're noticing, any specific type of I guess maybe culture? You know how there's certain things we say
Hmm.
because of diets of people, they eat certain types of food, like Indian people. They say too much,
Mm.
fat and starches can end up with giving them heart problems. So what would you recommend? Do you think that this is applicable to that kind of thing?
Well, with your type 1 diabetes, normally that's either predestined or born at birth with type 1. Not always the case, though.
Yeah.
But with type 2 diabetes, I'd say 99% of the time it's diet related. So, those people, I mean, diet related can mean from any age. In fact, type 2 diabetes is on the rise with young adolescent children. There's never been such an epidemic with children that have type 2 diabetes. And people need to look at what they're giving their children and what they're eating, the ultra processed foods, high, too much refined foods, not enough raw foods like vegetables and fruits, getting back to your basics. So anyone who's in that category as far as not eating right can bring on insulin resistance type 2 diabetes, because it can be a bit of a process in the body. So it's someone just doesn't get type 2 diabetes. It's a long-term abuse that happens in the body,
Mm,
when you have too much sugar and those foods that I've just mentioned, and your pancreas and your organs, and your liver that stores the fats and the sugars and things, cannot keep doing that over and over and over, year in, year in, year out. At some time, there's a breaking point. So, type 2 diabetes happens at any time in life where the body is being abused in that way. And it's just depending on where it is, how bad is the abuse. It might be a long time of just, not being very mindful about sugar and refined foods that create that environment, like when you're in your 60s and 70s. But
yeah.
then someone who drinks a lot of Coke and soft drinks and goes down that path and eats a lot of chocolate and fried foods, that whole scenario of junk foods, they might have type 2 diabetes in their 30s, which I see all the time,
Mm, mm, mm.
which is not nice, at 30 years old, and you're having to go on medication to control your sugar levels
Mm.
or your insulin levels.
Yeah, that's
Mm.
right. Alpha lipoic acid
Mm.
helps to lower LDL cholesterol and improve HDL.
Correct. That was one other thing I wanted to mention. A lot of people didn't know this, or still don't know that when you take it on a regular basis, if you have a cholesterol issue, you can, the bad cholesterol LDL will diminish with it, and it will raise your good cholesterol, your HDL, a bit like fish oil does. Fish
Mm,
oil
mm,
works in the same principle. Lipoic acid works in a similar principle to that as well.
mm.
So that's a really good thing as well.
Yeah, wow. And that weight management thing due to insulin
Mm.
resistance.
Correct.
That's an interesting one. Can you
Mm.
explain a little bit more about that, Lynn?
Sure. So, as I was just explaining, with the insulin resistance and the type of diet that you have, if you take the lipoic acid, it will help protect, I guess, the body in a way that if you are someone that's abusing or not being so mindful about the foods that you eat, if you take lipoic acid, it may help lose weight and control that insulin level and that insulin sensitivity in that way. But in saying that, that's probably not the healthiest way to control your weight,
Mm,
because
yeah.
really you need to get back to the core of what you're eating,
Yeah.
um, to get that in check.
Yeah. Weight management should be balanced and it should be healthy.
Correct.
It's about well-being and not about suffering.
Correct. And being miserable with
That's
weight,
right. That's right.
yeah.
Yeah.
And
Okay.
it's the mental, and depression and everything that comes with that as well, which you quite often overweight people have mental problems because they can't deal with their image or what they look like, or they can't stop eating.
Yeah. And can't and not happy with how they're feeling.
Exactly.
Because it doesn't feel comfortable. You know, yeah. Um, I think well, that's another topic for another day, don't you?
It is. Yeah, it's a big topic too.
Big topic. It's a big topic. Certainly a big topic. Well, then I'm going to stop sharing the screen. Is that okay?
Thank you very
All right,
much.
great. You're welcome. Right. Anything else, Lynn, that you want to tell us about this ALA, lipoic acid?
The only one thing I'd like to add, Rose, please, is when to take it.
Yes.
So if someone does have, diabetic neuropathy and needs to take it, it's best to take it last thing at night before you go to bed. And also too, because it's working and repairing the myelin sheath, And that's a lot of repair work. It usually takes about a month before you see any signs of relief from it.
Okay.
But you can be just about guaranteed you'll get some relief with that because it's the great builder of the nerve sheath. Mm.
Good, good. Thank you for that. That's always good advice because I think so important to know when to take the vitamin. It's okay to say take these
Mm.
vitamins, but when do you take them?
Mhm.
And I often find that, well, most of the time, if I take vitamins, it's better for me to take them more towards the end of the day than at the beginning of the day. But, that's my reasons. That's me personally. That's not for everybody. So, yes. Okay. Anything else you want to tell us before we say goodbye to everyone?
No, I think that's just about covered it. Of course, there's always, people can put their questions in the comment area. You were probably going to say that, Rose, but I'll say that.
Thank you
But,
for saying it.
yeah, happy to answer any questions there. If something arises or you're not quite sure about something, that would be awesome. Thank you.
Wonderful. Well, thank you, Lynn. Thank you very much for your valuable advice, or
Thank you.
information, I should say. And yeah, friends, if you are thinking that you need some advice, further advice about your situation, please get in touch with us, because Lynn can do a consult with you. And at the moment, we're talking about doing something, where people can come in and into a workshop with us and ask questions. But Lynn is available, and I can always just ask me in the comments, and I will connect the two of you. I'm just not putting Lynn's details out there at the moment because we just want to make sure that she's taken care of, and we're not giving her unnecessary emails or anything like that, especially with spam going on like it is.
Mm.
But yeah, I see myself going slow motion because our internet's a bit slow. Yeah. Sorry. Sorry, everybody. I don't know what's going on with the internet, but yeah. So yeah, looking forward to that. So do reach out if you think you would like a consult with Lynn. Reach out to us and we will arrange that for you. Okay. Thank you, Lynn. Thank you so much. Thank you. Would you like to say goodbye to everybody on your own and then I'll say goodbye?
Mm. Thank you, everybody, for watching. It's always a pleasure to be here, and I hope that in some way my information can help you with just a little piece of something that you didn't know.
Yeah.
Thank you.
Wonderful. Well, friends, thank you so much. Thank you for watching, and I'll catch you next time here on Ananda Rose Vite Bites. Bye.